Hi everyone, welcome back to Elevate with Jasmine. Today we have a very special guest, Dr. Regina Hampton. Hi Dr. Hampton, how are you?
I'm good. Thank you for having me.
Thank you so much for being here. So if you all are new to my world, you may not know, but I run this great company called Maya. We offer for breast cancer survivors completely customizable and fully insurance billable breast prosthesis, post-mastectomy bras with a state-of-the-art fit experience, including telehealth and pop-up experiences. And before that, for 5 years, Dr. Hampton and I ran together Cherry Blossom Intimates. It was a brick and mortar store in Prince George's County, Maryland, where we helped women who've had breast cancer and those who had not to find the perfect bra, all under one roof. It was a really, really special place. And Dr. Hampton is joining us today because it is Breast Cancer Awareness Month. So we're really excited to chat with her about some things we need to know about our health, how to make sure we're being proactive, what to look for, and so many other cool things. So let me tell you a little bit about Dr. Hampton before we get started. All right, Dr. Hampton is the Chief of Breast Surgery at Luminous Health Doctors Community Medical Center, which is the first breast center in Prince George's County. She is a board-certified general surgeon with a focus on breast health and breast cancer. Dr. Regina Hampton is also the medical director and co-founder of Breast Care for Washington, which is a nonprofit dedicated to providing access to screening, mammography, regardless of your ability to pay. She was elected the first female medical staff president in the 40-year history of Luminous, correct? Okay, of Luminous, which is incredible. The first woman president. We love that. Dr. Hampton attended the Medical College of Pennsylvania, which is now Drexel University, and Howard University. And the DC metro area is her home, which we absolutely love and adore, but she's originally from Seattle, Washington. Dr. Hampton is the only physician in the country who's also a certified mastectomy fitter. She is a member of Delta Sigma Theta Sorority Incorporated and the Links Incorporated. And she was featured in the Washington Post regarding Black women and breast cancer. She was recognized as the top doctor in Washingtonian magazine. And she has been featured in Essence magazine, NPR, The Russ Parr Morning Show, Buddy Check 9, and the Oprah Winfrey Network. So she knows her stuff. Thank you so much for being here, Dr. Hampton. Let's go ahead and kick it off, really jumping into a topic that I think is very important, racial disparities in healthcare. So we know a little bit about the breast cancer mortality gap for Black women. Can you tell us a little bit about why you think Black women are 40% more likely to die from breast cancer than white women, despite having a lower incidence rate?
Yeah, thank you for that question. So what's interesting is that Black women actually get less breast cancer than our white counterparts. However, our mortality rates are significantly higher, as you stated. And some of the reasons for that are because we get breast cancer at younger ages. We tend to get it under the age of 50, whereas white women tend to get it over the age of 60. And so when you have young women, say if they're even under 40, they're not at the age where it's time to get mammograms. And so those women often go from doctor to doctor, place to place with a symptom, and they're ignored. And so they're often diagnosed when someone finally makes the diagnosis at a later stage. In addition to that, Black women, younger Black women tend to get a type of breast cancer that's more aggressive, something called triple negative breast cancer, which means those are cancers that are not responsive to hormones, and so they usually have to be treated very aggressively in order to have success rates. And so when you combine all of that, it's kind of the perfect storm to account for the disparities that we see.
Gracious. Okay. And what about medical bias, the bias in medical treatment? Can you tell us a little bit about how racial bias in healthcare settings leads to those delayed diagnoses? Why are women walking in with symptoms that are being ignored?
Yeah, I think there are still those in the medical community that still don't understand these statistics and understand that if you see a young woman who comes into your office, you've got to really sit and dive deep and try to rule out cancer and not just assume that she just has, a simple cyst or just something benign going on. And I think, these disparities and racial biases certainly go back, decades and even centuries where, our communication of our symptoms are just not seen and heard, especially when you talk about pain. There still are those in the medical community who don't believe that when a Black woman comes and says that she has a symptom or pain, that, they think, oh, she can handle it, or, oh, it's probably not as bad as she's making it out to be. So I think it's very important for Black women to be their own advocates, and really to find providers that are going to see you and going to hear you and take your complaint seriously.
Great. As an aside, where do we find our doctors? Is there a place or a website where we can sort of see how doctors are rated? Or do we typically hear from word of mouth? Or how would you choose a doctor?
I have friends that I can call. But if you can't phone a friend, then I think, speaking to women in your network to see who they go to. Nowadays, there are ratings online. You have to kind of be careful of those because not all the ratings are good ratings. There are some other sites. There's like blackdoctor.org, Health in Hue. So there are some sites out there that do recommend doctors. And if you're trying to find someone in your particular community, then you should be able to use those resources.
That is actually a good reminder. I know Ashley Wisdom of Health in Her Hue. And I completely forgot about that, but that's a great reminder that that is a resource that's available to all of us. Okay, fantastic. Okay, tell me a little bit about information access, especially in minority communities. We know that it's contributing to late stage breast cancer diagnosis. Is there anything that can be done to sort of bridge that gap?
Yeah, I think, I call it, there's still the word on the street, and then there's still these myths and old truths that keep getting passed down from generation to generation to generation, that I think we all have to just stop a minute and when you hear some of these things, A, realize, well, who's the source? Mm-hmm. B, try to figure out, when did this information come about? So, I know grandma probably was treated 25 years ago, but so much has changed over 25 years, and really trying to go in and speak to a provider and get your own information. Again, we can't always believe everything that we see on the internet.
Right.
And really just trying to make sure that you're doing your due diligence. And sometimes it takes speaking to several different providers. I always tell patients it's okay to go and get a second opinion and to may hear the same information twice, and then you know that you're getting good information.
I love what you just said about myths in breast cancer. Misinformation, but myths, things that aren't true. A few that I want to address. Do underwire bras cause breast cancer?
I knew that one was coming. No, underwire bras do not cause breast cancer. And so, what I tell people is, we're really lucky to live in a country that most of the time, does things that are in our best interests. And if underwire bras were that bad, we probably would all walk around being saggy. We wouldn't be able to buy bras that have underwire. But underwires are important for some women because they really, really need them, and really helps to provide support. But ladies, keep your bras on. Bras do not cause breast cancer.
Okay. How about, do mammograms cause breast cancer or cause breast cancer to spread?
So mammograms are safe. We know that mammograms don't cause breast cancer. It does have radiation. We do admit that. But the low amount of radiation is very minimal compared to the number of lives that we save by doing mammograms. So very important to get your mammograms and not to worry about the amount of radiation.
Okay, that's good to know. Because a lot of things in our daily life have radiation. Airplanes. Absolutely. Have radiation.
We're getting some right now.
Right. Microwaves, maybe even, things that are just around us that we can't physically see all the time and we're not even aware of. So what you're saying is the radiation that's inside that machinery or that could be emitted is completely safe, especially when it comes to just making sure that the potential lumps you have or potential challenges you have would not be impacted.
Yes, absolutely.
Okay, we love that. Okay, what about cell phones? Do cell phones cause breast cancer?
No, they do not.
Okay. Just
Even those who carry them in their bra.
Okay, okay, but please don't
Not sure
do
why
that.
you want to do that, but.
Okay, and then another one, does birth control, the pill, does that cause breast cancer?
It does not.
Okay, all right, good to know. We've cleared these up. All right, so now that we're on the topic of just being honest about breast and breast cancer, why does it feel so uncomfortable when you go and get a mammogram? Why are we getting smushed?
So I don't like to say that they're being smushed. They're being gently compressed.
Okay.
And it's really important because we all have lumpy bumpies in the breast. So if we all were to just go in, get a mammogram without that compression, we'd probably all look like we have something abnormal going on when it's really just our normal tissue. So what the compression does is it really helps to settle out the normal breast tissue so that only the bad things don't compress. Okay. And those are the things that we want to hone in on and get more information about, possibly do a biopsy to see if it's something that we need to treat.
Okay, and do men get breast cancer?
Yes, men do get breast cancer. They account for about 1% of all breast cancers. And men are treated the same way that women are. So they can get lumpectomies, they can get mastectomies, and they even can be treated with the hormone pill as well.
Good to know. And do they get mammograms?
They can. If a man feels something on his chest, then he should go to his doctor, get that checked out, and then we would recommend getting a mammogram. But they don't have to do the regular mammograms like women do.
What would something feel like for a man? Can you tell us what that lump or bump, can you maybe describe that for us, what they should be looking out for?
Yeah, so it can just be an abnormal lump when you're comparing both sides. Sometimes one side may be a little bit larger than the other. It may feel like there's something like a little marble or a little pebble or a little pea that's in the breast that wasn't there before. Sometimes they can have a little bit of tenderness in the breast, and sometimes they can have discharge from the nipple, which typically we don't see in men.
Okay, wonderful. And outside of that discharge, which we know sometimes women do have that, what are the signs and symptoms that women should be looking for when checking their breasts at home?
So I always tell women I think it's important to continue doing breast self-exams, and I know there's been a lot of controversy in the literature, women shouldn't do it, but I think it's really important. I say you live with yourself. You only see your doctor once, maybe twice a year, and so with you being able to do your own exam, what you're doing is, I always say, first learn what your normal lumpy bumpies feel like. Mm-hmm. Once you know what your normal is like, or your partner could become familiar, then you know more about what's abnormal. Okay. So if you feel something that you just have never felt before and it doesn't seem to go away after a week or two, then that's something to get checked out. If the breast is all of a sudden larger than the other side, if the skin looks different, like an orange peel feel and look to it, that would be something to get checked out. And I think it's really important not only to check the breast, but also to check underneath the arm. Because in many of us, our breast tissue extends all the way up under the armpit. So really important to feel there. And if you feel a lump there that does not feel normal, it's important to get that checked out as well.
Okay. I'm curious, where does breast cancer actually just come from?
Yeah, we don't really know. I think there are some people who may have genetics or have the breast cancer gene. And what that means is they already have a pre-programmed genetic marker in their breasts that tells us that they're going to get breast cancer. There are also some women, because of family history, and they may not have the gene, but we think there are some other genes that haven't been discovered yet, especially in women of color. But we think that cancer cells just live in all of us, and then there's something that turns them on. The question is, what is that turns it on? Is it something environmental? Is it stress? Is it, those are the things that we're really trying to figure out.
So tell us a little bit about the genetic aspect of that. If you have a family history of breast cancer, what should you do?
So I think it's really important to know health history in our families. So we should know what types of cancer, and not just breast, but ovarian cancer, colon cancer, lung cancer. And it's really important to know the age, because if we have members of our family who had breast cancer or any cancer at younger ages, then we probably should start screening about 10 years prior to that youngest person. So if grandma was 42 or mom was 42, then we should start doing mammograms in the women in that family starting at about age 30, age 32.
Okay. So after that, if you've discovered that you had that as a challenge, what are the options for you? If you've discovered you have a history of breast cancer and you've gotten your genetic testing or you've done your mammograms and you see that you have breast cancer, what do you do now?
So I think it's important to exhale,
Okay.
take a deep breath, and
Take a deep
exhale.
breath. Okay.
Yes. I think the good thing for people to know is that breast cancer is very treatable. Even some of the more aggressive breast cancers can be treated if we attack it aggressively. So I think it's important to find an oncologist, a medical oncologist. They're going to do the medical piece, chemotherapy and or hormone therapy, a surgeon. And the surgeon is going to be the one who does the surgical procedure and takes the cancer out, which can be just removing just the cancer and leaving the breast, or removal of all the breast tissue. And then a radiation oncologist. So some patients may need radiation after having surgery as a part of their treatment. And then the medical oncologist does not only chemotherapy, but hormonal therapy, which is just a pill.
So on the topic of self-advocacy, once you've been diagnosed, you've found the right physician, you feel like you're on the right track, you're scared. What do you do at your appointments? I know patients who've told me, I have all these questions, I get there, I don't know what I'm doing, and they told me to do something, and I don't know what they told me to do. And they gave me this medication, I don't understand it, and they're just as confused, if not more so, than when they walked in the room. So what should we be doing in the room of our doctor?
So I think it's important to have somebody with you. I think it always helps to have a second pair of ears. I know when I'm first giving someone the diagnosis, I know the second I say you have breast cancer, that's it. The light's out, the shade is closed. She's not going to hear another word that I say. And so that's when it can be helpful to have that second pair of ears who can really hear and take in all the information. I find it important to really, I think people still try to rush through the process. Yes, it's cancer. Yes, we want to get rid of it. But it is so important to be able to have that time, energy, and space to hear all the options. So I think it's important to go, speak to the doctor, take somebody with you so that you have another pair of ears. I think it's important to take notes. If you're want to hear a recording, ask the physician if you can record the conversation so that you can play it back later. And then I think it also helps to come with your own list of questions. Whip out your little piece of paper and say, hey, I've got a list of questions. I want to walk through these. And again, if it's a provider who's not going to take the time to go down that list with you, that's probably not the provider for you.
Okay, so it should not feel like a rush. It should feel like they're really, truly listening.
Correct.
Oh, okay.
And sometimes it takes multiple appointments. I think it's important. I know for me in my personal process, I'll see a patient, give her diagnosis, and then I almost just send her away.
Okay.
Because I know she's shut down. She needs time to process. We're going to come back a few days later and then really dive deep into what is the treatment plan, again, with that second pair of ears, so that we can all have good conversation and dialogue about what the treatment plan looks like.
Okay, good to know. Tell me a little bit about age as it relates to screening recommendations. We touched a little bit on, if you have a family history, but if you don't have a family history, when should you start getting mammograms?
So the current recommendation is starting at age 40 if you're what we call asymptomatic. You don't have any symptoms, you don't feel a lump, nothing's going on. Then starting at age 40, you get a mammogram every year. If you have the family history, you're going to want to start 10 years earlier. And if you're someone who under the age of 40 has a symptom, then you're going to want to go in and see a doctor. We may not send you for a mammogram, but we may send you for a sonogram, do a clinical breast exam to see what's going on.
Okay, and those are just as effective as a mammogram, or what would be the difference there?
So a mammogram and a sonogram, they just look at the breast a little bit differently.
Okay.
So a mammogram, which as we talked about, uses x-rays. And what that does is it just looks at the breast tissue in general. But sometimes when we're young and have really good, perky, dense breast tissue, the mammogram may not show us everything. So then, in addition to that, we're going to add a sonogram, which is going to provide a lot more detail.
Okay. On the topic of dense breast tissue, I've read recently that there will be like announcements to patients when they have that. Can you tell me a little bit about what that means?
So first of all, dense breast tissue is just normal breast tissue. So, when we're younger, our breast density is increased. That's because I always say our breasts are good and perky and they're sitting up high. And as we start to get older, as we have children, as we breastfeed, as we gain weight, lose weight, we lose all that good perky breast tissue, and then the breasts start going south and becoming more fat replaced and fatty. So the density that we see when we're younger, we kind of lose that as we get older. So dense breast tissue is going to be documented on the mammogram report now. And women will have the ability, if they see that on their report, to go have a conversation with their doctor to see if they may need an additional test like a sonogram, or some patients may even need a breast MRI.
Oh, okay, good to know. Last kind of topic about this, advocacy, and well, I have a few actually. I won't say last. Okay, I want to hear a little bit about the advocacy work that you've been doing in this space and how advocacy is advancing the world of breast cancer.
Yeah, so my big thing is really advocating for Black women and really making sure that it's clear to Black women that we get mammograms starting at age 40. I think it's also important that we advocate for genetics and genetic testing. I don't think that there's been enough of that in our community. And so really making sure that patients understand when they should get genetic testing, when they qualify for genetic testing. Because if we can find a genetic marker in a family, it really can be life-changing. I mean, we really can change the course of future generations, especially if they happen to have that BRCA or BRCA gene. Because if we can find it, then we can present that woman with options. And some of those options may be doing something, having surgery before she even develops breast cancer.
Wow, that's powerful. Okay, and then a little bit about stereotypes. Okay, so especially as it relates to the challenges that Black women may be facing when going to see their doctor. We touched on that very briefly, but I want us to can you tell me a little bit about how pervasive that may be and what Black women can sort of do to be sure that they're advocating for themselves so that they're not up against this additional barrier when they're facing their challenges?
Yeah, I tell women, I think we do a good job when we want to get a cute dress. We're going to shop around for the best price. We're looking at a pair of shoes. We're going to shop around for the cutest pair, the one that has a good price. We really should do that with our doctors. And while you may go in and see one doctor, don't feel like you're limited to that doctor. Ask questions, kind of interview the doctor to see if that's going to be the right doctor for you. And don't be afraid to say, you know what, this doctor is not working for me. I need to make a change. Or it could be a doctor that you've been with for the last 5 to 10 years and it's just so familiar that you feel like, but I feel like they're now not hearing me or they're not up on the latest. So it's okay to go and find another doctor. But for me, it's just really advocating and trying to get my colleagues to understand that breast cancer in Black women is different and we really need to take it seriously.
Okay, and then on the topic of seriousness, mental health in this journey, getting a diagnosis can be incredibly stressful. It can change the course of your life, but so much of it begins with what's happening in your mind. How do women who've been diagnosed or who have fear around breast cancer, How do you recommend that they cope? What do you recommend that they do for next steps as it relates to their mental health?
Yeah, I think that is definitely something that's really important. I know, when I make a diagnosis, I always think of not only the cancer in the body, but I always ask the patient to think about, well, what are the other cancers in your life? Work, could be your spouse, kids, could be your job. Really just taking inventory of your whole life and seeing how we can get rid of some of those things that cause us stress or cause us angst or just don't make us happy. I'm also a big advocate for getting mental health when we need it, getting therapy. I think therapy is great and can be very powerful during that whole journey, treatment journey. And again, trying to help find some of the other cancers in our lives that we probably should cut out, and having that mental health support really can be helpful in that journey.
Wow. Dr. Hampton, is there anything else that you'd like to address to our audience? Anything else you want the audience to know?
I think it's important for women, for especially breast cancer survivors, to understand that there's actually a federal law that provides protection for them. And this federal law provides for these women to get reconstruction, whether they've had one breast or just a part of the breast removed, and also provides for bras and prosthetics. I say that breast cancer survivors should never have to pay for a bra out of pocket. It should be covered by insurance, so it's really important that patients know and understand this information, and they can find us through Maya, who can provide those items for them.
Awesome. We've all been impacted deeply by the COVID-19 pandemic. How has breast cancer and the world of breast cancer changed since the pandemic? What are you seeing for diagnosis rates, for patients coming in to be seen with their physicians? How has COVID impacted the world on that side?
Yeah, COVID, impacted, all aspects of health. So, for a while we had stopped getting mammograms, we had even stopped doing surgeries. So we were seeing women who are coming in at later stages. We think that is now settling back out again, where women are back getting their mammograms. We're of course doing surgeries again and really getting people back on the treatment path. So really important for people to know in the post-COVID world, we're still aware of COVID, but we also want to get back and be proactive in breast cancer screenings and breast cancer treatment.
And then tell me a little bit about the diagnosis rate that you're seeing. I'm hearing that it should be increasing actually in the near future. Is it diagnosis rate and mortality rate that are both increasing? And what have you been seeing on that front?
Yeah, so the diagnosis rate has increased slightly. And interestingly enough, we're starting to see more younger patients who are getting diagnosed with breast cancer. And, it's going to take a lot of clinical trials to try and figure out, well, why is that? Is it environmental? Is it, something that we're eating? Is it our lifestyle? So trying to figure that out. So younger women really being proactive and being aware of their own breast health. And with that, they also found that for the first time in a long time, there's an increase in breast cancer rates in Asian women. So really important for all women of color to really be diligent on their mammograms, doing their breast self-checks, knowing your family history, and getting something checked out if you think something's going on.
Thank you so much for your time today, Dr. Hampton. It was wonderful to sit down with you. If you'd like more information about Dr. Hampton, you can find more. Where can we find you, Dr. Hampton?
You can find me at drreginahampton.com.
Wonderful. And if you'd like more information about Maya for post-mastectomy bras and prosthesis, virtual fitting services, and even maybe a pop-up near you, you can check us out on maya.com. That's MYYA.com.